A lot of time, the prep for the colonoscopy is the hardest part, so let's talk about it. The preparation for colonoscopy is extremely important because the goal of colonoscopy is for the physician to be able to inspect the entire colon from the beginning around the anus all the way to the small bowel. And the better the preparation, meaning the cleaner the colon, the higher likelihood that even small polyps will be detected by your doctor and removed. The preparation consists of a liquid diet starting about between a day and 3 days prior to the colonoscopy. Your doctor might prescribe some laxatives. He might prescribe some stool softeners and fibers. And what you need to know is that you want to avoid anything red or colorful during the last 24 hours of your colonoscopy in order to avoid confusion with possible bleeding or obstruction of findings during colonoscopy. Typically, the day before colonoscopy, the patient will start on a liquid diet, meaning fluids, Gatorade, although not red ones, tea, coffee. You want to avoid alcohol, obviously, broth, but no noodles or chicken soup. Anything that might obscure your view should be avoided. Around noontime the day before, you will take your first stool softeners, 3 or 4 of them as usually prescribed. And then at 6 p.m. the night before, you will start taking a solution which will increase your bowel movements and basically start cleaning your bowels. That means that you have to be very close to a bathroom the night before the colonoscopy. You can expect to go to the bathroom every 15 minutes or so until the stool is very, very clear. Again, this is very important because studies have shown better preparation correlates with better detection of small polyps, which in turn means detecting precancerous lesions before they develop into cancer. So that will also translate into better outcomes for the patients. We have seen cases of cancers developing in patients who did not have optimal colonoscopies, and those are things that should be avoided when we try to adhere to the guidelines and the recommendations by a doctor prior to colonoscopy. As a matter of fact, it is much more important for the patient to know that after the colonoscopy they will not be able to drive home, so they definitely need a ride home because they will receive medication that sedates them and they will be drowsy. In terms of the day before, once we explain what to expect, the patient will know if their work schedule or work environment will allow them to go to work that day or not. So as a matter of fact, we usually counsel them about the day of colonoscopy, because that's where they really need a ride and need to make sure that somebody takes them home safely.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.